Hey there, future mamas. Are you in the midst of trying to conceive, carefully scrutinizing every subtle change in your body? You're not alone. Many women aspiring to become pregnant eagerly seek out the earliest signs of pregnancy, even preceding a missed period. While the definitive confirmation of pregnancy lies in a test, several typical symptoms may suggest that your body is undergoing the remarkable transformation of early pregnancy. In this video, we'll delve into the top 10 early indicators of pregnancy you might encounter before realizing your period is overdue. These subtle shifts can serve as the initial hint that you have a little one on the way. So, whether you're actively attempting to conceive or simply intrigued by the early signs of pregnancy, continue watching to discover more about what to be vigilant for. Before we commence, remember to hit that like button and subscribe to our channel for additional pregnancy and motherhood content. We offer a plethora of informative videos to support you through this exhilarating journey. During the phase of actively trying to conceive, the 2-week interval between ovulation and your anticipated period can seem interminable. You may find yourself meticulously analyzing every minor sensation and alteration in your body, pondering whether it could indicate early pregnancy. While the only foolproof method to ascertain pregnancy is through a test, there are certain commonplace symptoms that many women encounter before missing their period. 1. Implantation bleeding. One of the initial indications of pregnancy is implantation bleeding, occurring when the fertilized egg attaches itself to the uterine lining. This process can take place anywhere from 6 to 12 days post-conception and typically manifests as a much lighter discharge compared to a regular menstrual period. Implantation bleeding may present as faint spotting or a pinkish discharge, typically lasting only 1 to 2 days. Some individuals might confuse this with an early period, yet there are distinct differences. Implantation bleeding tends to be lighter in color and flow than menstrual blood, and it deviates from the usual pattern of a regular period. If you observe light bleeding around the anticipated period time frame that doesn't progress into a full flow, it could indicate early pregnancy. Nevertheless, not all women undergo implantation bleeding, so its absence doesn't necessarily imply non-pregnancy. 2. Tender, swollen breasts. Another prevalent early indication of pregnancy involves alterations in breast appearance and sensation. As your body readies itself to nurture a developing fetus, hormonal fluctuations can prompt your breasts to become tender, enlarged, and weightier. You might observe increased sensitivity to touch or notice darkening and protrusion of the nipples. These transformations stem from heightened estrogen and progesterone levels, which stimulate the expansion of milk ducts and prime your breasts for eventual lactation. Some individuals liken the sensation to a sense of fullness or weightiness, akin to premenstrual breast sensations but more pronounced. If you're encountering breast changes and suspect pregnancy, it's advisable to procure a supportive bra to help alleviate any discomfort. 3. Fatigue. Experiencing persistent exhaustion, even following a restful night's sleep, is another typical early symptom of pregnancy. As your body endeavors to nurture the growing embryo, you may find yourself more fatigued than usual. This weariness arises from heightened production of the hormone progesterone, known to induce drowsiness and lethargy. Additionally, in early pregnancy, your body increases blood production to support the developing placenta, further contributing to feelings of tiredness. Many expectant individuals describe pregnancy fatigue as an ongoing state of weariness, impeding their ability to engage in daily tasks. If you typically maintain high energy levels but suddenly find yourself requiring frequent naps or struggling to remain awake throughout the day, it could signify pregnancy. 4. Nausea. Arguably one of the most recognized symptoms of pregnancy is nausea, commonly known as morning sickness. Despite its name, this queasiness can occur at any hour of the day and might commence as early as 2 weeks post-conception. The underlying cause of this symptom is the rapid elevation of the hormone human chorionic gonadotropin, HCG, generated by the developing placenta. Pregnancy-related nausea varies in intensity, ranging from mild queasiness to severe vomiting, and can be triggered by specific scents, foods, or an empty stomach. Some individuals discover that consuming small, frequent meals and avoiding strong odors can mitigate nausea. Additionally, ginger, whether ingested in tea, candies, or supplements, has demonstrated efficacy in reducing pregnancy-induced nausea. If you're grappling with severe nausea and vomiting, hindering your ability to retain food and fluids, it's imperative to reach out to your healthcare provider for assistance. 5. Heightened sense of smell. The onset of early pregnancy can lead to an enhanced olfactory sensitivity, causing previously subtle scents to appear overpowering or even repulsive. This symptom is believed to be linked to heightened estrogen levels in the body during pregnancy. You might notice that specific aromas, such as perfumes, food, or even your partner's natural scent, become more pronounced or unpleasant. This heightened sense of smell may also exacerbate feelings of nausea and aversions to certain foods. If you suddenly find yourself more responsive to odors and are encountering other early pregnancy indications, it may signify that you're pregnant. 6. Frequent urination. Due to your body's increased production of blood and fluids to sustain the developing embryo, you might notice a heightened frequency of urination. This increased need to urinate is also influenced by the hormone HCG, which enhances blood circulation to the pelvic region and can prompt more frequent urination. Additionally, as your uterus starts expanding, it can exert pressure on your bladder, resulting in more frequent visits to the bathroom. 7. Mood swings. Fluctuations in hormones during the initial stages of pregnancy can induce mood swings, leaving you feeling emotionally sensitive, irritable, or occasionally anxious. These mood fluctuations stem from the rapid changes in estrogen and progesterone levels, which can influence neurotransmitters, the brain chemicals responsible for regulating mood. You might find yourself more emotionally reactive than usual, shedding tears over minor matters or experiencing sudden waves of happiness or frustration. If you're noticing alterations in your mood alongside other early pregnancy symptoms, it might indicate that you're pregnant. It's important to be kind to yourself and prioritize self-care during this period. 8. Food cravings or aversions. The early stages of pregnancy can bring about shifts in your taste preferences, resulting in sudden cravings for particular foods or aversions to others. These alterations are connected to hormonal changes in the body, which can impact your sense of taste and smell. You might discover yourself yearning for specific types of food, like salty or sour snacks, or feeling a strong distaste for foods you typically relish. Food aversions are especially prevalent during the first trimester and can be triggered by the scent, flavor, or mere thought of certain foods. 9. Implantation cramping. Some individuals might encounter mild cramping or a sensation of pulling in their lower abdomen during the period of implantation. This sensation arises from the attachment of the fertilized egg to the uterine lining and can resemble menstrual cramps, albeit usually less intense and shorter in duration. Implantation cramping commonly occurs approximately 6 to 12 days post-conception and may coincide with implantation bleeding. If you're encountering slight cramping around the anticipated period time frame that doesn't evolve into a complete menstrual flow, it could indicate early pregnancy. 10. Missed period. One of the most widely recognized indicators of pregnancy is a missed menstrual period. If you typically have a regular menstrual cycle and your period is more than a week overdue, it's advisable to take a pregnancy test. However, it's essential to understand that not all missed periods stem from pregnancy. Factors such as stress, fluctuations in weight, hormonal irregularities, and specific medications can also lead to menstrual delays. If you've missed a period and are encountering other early pregnancy symptoms, it's prudent to verify your pregnancy status through a test or consultation with your healthcare provider. Although experiencing one or more of these early pregnancy symptoms can be thrilling, particularly when attempting to conceive, it's crucial to recognize that each woman's pregnancy journey is unique. Some individuals may observe several of these signs, while others may not notice any notable symptoms until after a missed period. Moreover, many of these symptoms can be attributed to factors aside from pregnancy, such as stress, hormonal fluctuations, or illness. Should you suspect pregnancy, the recommended course of action is to undertake a home pregnancy test or arrange an appointment with your healthcare provider. Home pregnancy tests yield high accuracy when used correctly and can detect the presence of the hormone HCG in your urine as early as the first day following your missed period. If the test yields a positive result, your healthcare provider can confirm the pregnancy and assist you in navigating the subsequent steps, including scheduling prenatal visits and discussing any necessary lifestyle adjustments. It's important to remember that the path to motherhood varies for each individual. Trust your intuition, prioritize self-care, and don't hesitate to seek assistance when necessary. Whether this marks your first pregnancy or you're a seasoned parent, every pregnancy constitutes a unique and cherished experience. Ultimately, listen to your body, heed your instincts, and reach out for support as needed. If you enjoyed watching this video, don't forget to like, subscribe, and turn on the notification bell, so you don't miss any new videos. Let us know your thoughts about this video in the comments section down below, and feel free to stay and enjoy it until the end. Also make sure to check out our next highlighted video, and we will see you next time. Thanks for watching. Please like, share, and subscribe.